is a chronic condition, meaning it is there for a very long time. It is definitely controllable. It is controllable by the use of medications. It is controllable by lifestyle changes. It is controllable by trying to identify and eradicate triggers as much as possible. But while it is controllable, it is not curable. So it is important to realize this. And for many persons, once their asthma is controlled, they may not have any symptoms of asthma for weeks, months, and sometimes for years. But there is always that underlying predisposition that if exposed in certain circumstances, that they can then have a flare of their asthma. So once again, controllable but not curable. So the requirements with respect to medication may vary, even between people and within a person who has asthma. You may have 3-4 persons with asthma and they are on different types of medication in order to keep their asthma under control. So it is not just one medication that is appropriate for everyone. And within a person who has asthma, their medication requirements may change depending on if their asthma is more severe, if they're having more frequent attacks, then certainly they will require sometimes more potent or more medication to keep it under control. But once it's controlled for a protracted period, then we can begin to reduce the amount of medication that the person is on. Some persons with asthma will require medication for the rest of their lives. And it is not that they are addicted or now completely reliant on the medication. There is no true addiction to the medications that we use to manage asthma. It is just that to keep it under control and the frequency and the severity of which they have to have attacks, they will require medication. And yet you will have someone else who may go weeks, months, years and not require anything. So it varies, but yes, you do have a subset of persons that will require medication for the rest of their lives in order to keep it under control. Definitely, we advocate that persons with asthma live full lives, and that is the whole reason of treating asthma. Yes, uncontrolled asthma can be fatal, but we also want the asthma controlled so persons go back living and leading a normal life. So someone with asthma, we advocate exercise, and we need that child at school to be playing PE. We need persons to be playing sports. We need persons to rejoin life as they knew it before. Now, there are certain activities such as exercise in some persons that may make the asthma worse. If this is the case, we know how to manage such instances where we may have to give medication prior to the person exercising, prior to the sporting event, prior to the person going out. But definitely, we don't want the person to become a couch potato. We need them living full lives, participating in sports and activities. And sporting events also help with the overall condition of the body and with how healthy the lungs are. So we do advocate exercise, but exercise under the guidance of your doctor.